LeBron James' 18-year-old son Bronny is in the hospital this afternoon after going into cardiac arrest.
It happened when the star athlete was taking part in a basketball practice at USC. The family releasing a statement saying he is now in stable condition and out of the ICU. Bronny James recently graduated from Sierra Canyon High School in Chatsworth and is an incoming USC freshman, and NBA scouts consider him one of the nation's top high school basketball recruits.
Just what would cause a young athlete to go into cardiac arrest? That's a question many are now asking about Bronny James.
And Saleh Health reporter Denise Tador is here now with what cardiologists are saying and that may have led to this young athlete's cardiac emergency and how it's different than a heart attack, Denise.
It's very different, but related. We'll tell you about that. A sudden cardiac arrest in a young athlete is something we've seen many times before, but doctors say it's important to remember it's rare. Cardiac arrest affects about 2,000 people under the age of 25. It occurs in up to 450,000 Americans each year, and doctors say we can all learn from what happened to Bronny James.
Perfectly strong and healthy 1 second, and then suddenly on the floor the next.
It's very disheartening. It's very disturbing.
Cardiologist Dr. Saleh with Dignity Health Northridge says athletic trainers near 18-year-old basketball player Bronny James knew exactly what to do because they recognized what happened to the young USC star.
Cardiac arrest means that the heart stops.
It occurs when the heart malfunctions and stops beating unexpectedly. There are a number of causes.
Most of them are congenital. One is hypertrophic cardiomyopathy, where the heart is thicker than normal.
Doctors believe this was the underlying reason why Loyola Marymount player Hank Gathers collapsed after that famous dunk in 1990. Other causes include myocarditis or inflammation of the heart muscle, a hard hit as in the case of football player Damar Hamlin, heart rhythm disorders, or even dehydration.
Was this just an issue of electrolyte imbalance, for example? You know, low potassium, low magnesium.
Cardiac arrest is different from a heart attack, which occurs when blood flow to the heart is blocked. But this, too, can also stop the heart's electrical function. Whatever the cause, fast action saves lives. The first thing is to immediately start CPR.
If you're not providing blood to the brain can die.
The faster a patient can get treated with a defibrillator, the better the outcome.
In a community setting, defibrillators can be very effective.
Depending on the cause, many players can safely return to play, which is what Dr. Saleh is hoping for Bronny James.
There's so much that we are able to do in the field of cardiology. I trust that he's in the best of hands.
As for prevention, efforts to screen young athletes for any potential heart issues is not universal. Many schools and state programs have protocols in place, but there's no uniform access. But I do see that more and more schools are doing this, so that's good news.